For in the final analysis, our most basic common link is that we all inhabit this small planet. We all breathe the same air. We all cherish our children's futures, and we are all mortal.
This small planet. A cosmic riddle with a breathtaking landscape. It is home to 7.5 billion people, each born with limitless potential and the ability to impact the world in their own unique way. But in too many large cities and small villages, dreams are shattered and lives cut short by illness and disease. Six million children under the age of 5 die every year from preventable diseases, along with 300,000 of their young mothers. Diseases like malaria, tuberculosis, rheumatic fever, and pneumonia still claim millions of lives. As life expectancies have grown, heart attacks, strokes, cancers, and so many other non-infectious diseases have become epidemic worldwide. The number of people disabled by poor health is staggering. Over 1 billion people today are in such poor health that they are unable to care for themselves or their families, becoming victims of a vicious cycle of disability and poverty, which becomes near impossible to escape.
As an economist, your great economic policies go out the window if you can't satisfy basic human needs in terms of health. And you can educate a lot of people, but if the mortality and morbidity is high enough, you're not going to get the economic return.
Recognizing the need to educate our medical students for a global world, conduct global health research, and provide clinical care to poor populations, the Global Health Initiative was founded 11 years ago. Over those years, the GHI has sent over 1,100 students, residents, and faculty to over 42 countries worldwide, working to find long-term solutions for the health issues afflicting so many. The results have been impressive. Medical students' attitudes are often transformed during these global rotations, and nearly 100,000 people have received medical treatment which had previously been non-existent. In addition to clinical care, our students are involved in multiple complex research projects. Pamela Wax, a student getting a combined MD-MBA degree, has worked on the NEST project, a multi-center collaboration to help reduce neonatal mortality in sub-Saharan Africa.
Part of my role as part of the nest team was to travel to Tanzania and to talk to clinicians, nurses and physicians there about things that their hospital needed and areas that they were lacking. And what I realized is that it's not just a matter of not having the equipment or not having the capital to get the equipment, but there weren't even distribution networks set up to be able to deliver the equipment to hospitals.
With GHI funding, she was able to see what is possible if global health problems were approached from multiple disciplines, from medicine to business strategy to biomedical engineering.
I think that a lot of the problems at global health aren't just clinical problems, aren't just business problems, but really a mesh of the two.
This collaboration of multiple disciplines is critical in finding sustainable solutions to global health problems. Over 11 years, the GHI has laid the foundation. Dr. Robert Havey, founder of the GHI and director of the Institute campaign, has seen the challenges and benefits of good medicine and understands what is possible if the resources of the GHI can be expanded.
I'm a practicing physician. I see the suffering every day, but I've also seen what the GHI has done, and I know we can do that on a worldwide scale, but it doesn't happen easily.
Dr. Robert Murphy, director of Northwestern Center for Global Health, has spent his life in global health work and understands the suffering so many people around the world face each day. Only with continued research can sustainable solutions be found.
So not only do we do research training and educational exchanges, but we actually do hardcore research. We're studying about the unusual forms of tuberculosis in Mali. We're studying about developing biomarkers for liver cancer and for cervical cancer in Nigeria.
But he knows that funding shortfalls threaten to stop the critical work at a moment's notice.
Grants go typically 2 to 5 years, some are 7 years, and we're always struggling to keep those grants afloat, whether they be from a foundation or the NIH or CDC or whatever.
Understanding that solutions to global health problems requires careful study of diverse populations and health systems, the GHI is collaborating with a wide range of international partners. Brazil is the largest country in South America, with a population of 208 million people. Despite great progress in recent years, the country still struggles with poverty, high infant and maternal mortality, and a lack of basic services in many areas. The state of Pernambuco is the poorest region in all of Brazil. This past spring, Northwestern faculty traveled to this region to work with the local health experts to find sustainable solutions. Mr. Marcos Dubé knows what is possible in his home country of Brazil if collaboration with Northwestern is expanded. He has signed on as Brazil's ambassador to Northwestern's campaign for the Institute for Global Health.
I really think that the ongoing support of the Global Health Institute will transform a very important portion of our population. And using this as a case, we can start to connect other dots between other countries, because once you deliver, you create hope. And when you create hope, you create momentum.
Northwestern's Institute for Global Health will be unique, containing 10 centers under one institute to tackle global problems in a coordinated and comprehensive way. Multiple professionals will reside under one roof, with centers in infectious diseases, cancer, heart disease, and neurological disorders, such as Alzheimer's and Parkinson's. The Institute will find ways to train under-resourced countries in modern surgical techniques and rehabilitation services, help build effective primary care systems, and disseminate e-health technologies to providers in the most remote regions of the world.
It's a really great opportunity to bring different training and different mindsets together into one space and to work together on an actual practical problem where, you know, if you go into global health, you see that you will be working in interdisciplinary groups, and bringing, you know, an economist training with a law student's training with a med student's training together really will help solve the problem much better than just one discipline alone.
The Global Health Initiative has laid the foundation, showing what is possible.
But the way to make the larger difference is to incorporate other things. You know, what are the political structures that need to be constructed? What are the economic investments that can eventually bear fruit? And it's not just helping individuals in a clinic, as important as that is. You know, it's the broader picture. And what this institute's going to do is address the broader picture.
The GHI has started the work and accomplished great things, but so much more needs to be done. The work has to be continued, the scale expanded, the solutions made more affordable and long-lasting. Using the talent and resources at Northwestern, an Institute for Global Health will become the world's leader in global health education, research, health policy, and clinical care.
We know that if we're going to build multiple programs over a long number of years, that we're going to need a certain income, and that only comes from an endowment. We feel that we have the infrastructure and know-how to make a difference, and we think we can expand this at a global level if we can find the right level of funding.
The GHI was founded on the basic commitment that every person born on this earth deserves a chance to live a healthy and productive life. Through the work of the GHI, we have seen health regained and hope restored. so we know what can happen when you bring life-saving care to the world. That commitment has become a reality because so many have lent their support, knowing they were helping thousands of people they will never meet, who live in places they will never visit. All because they believe that together we can make a world of difference.